Welcome and thank you for everyone that has joined us for today. My name is Robert Hess III with Hess III Consulting, and today we're going to be discussing strategies for how we can strengthen resilience, especially in these turbulent times we find ourselves in. So as we get started today, we're going to first kick off, please respect and honor everything that is shared today. This is our intellectual property. Happy to, give permission for folks to share and use this as desired. Just please reach out to us if you would like to do that. I'm not going to go through too much history about who we are, but we've been around for a little while, about 15 years here in Arizona, and doing lots of different work here and nationally. So please check out our website to learn more. So getting into the good stuff, what we are here today to discuss is, of course, I want to have a high-level discussion about the state of the universe. There is a lot of changes every single day, rapidly evolving environment, as well as there is a significant contraction happening in Medicaid. So we're going to talk about that. All of the changes that are happening, leads to a market disruptions. We're going to talk through what that means for us, and then ultimately get down to what can we do about it, right? So I do want to take a little bit of time and talk about leadership strategies. All of us are leaders in this industry, whether that is at a supervisor level, management, executive leadership within an organization, working for government or public sector entities, so city, county, state, federal governments. So I want to make sure we can talk through all of the different ways or things that we can be thinking about and focusing on as we navigate these uncertain times. So I'm going to go ahead and dive in. We've got a lot of stuff to cover, and I was very aggressive with these PowerPoint slides. So I hope we're able to get through it all. So let's talk about the state of the universe. So several of y'all may have seen our recent blog posts and some of the stuff we put out on social media around the market contraction that is happening in Medicaid right now. A lot of this is driven very directly by the public health emergency. And so what this graphic shows is the enrollment change, specifically in Arizona Medicaid. So at the beginning of the public health emergency, folks may recall that the federal government released or stopped the requirement, put a pause on the requirement that states do eligibility redeterminations. So traditionally, states, either on an annual basis or every 6 months, are verifying or re-verifying that Medicaid members still qualify for their insurance and for those benefits based off of their income or qualifying category of eligibility. During the public health emergency, those requirements were put on pause. And so what we saw was this, continuous increase in membership, but there was no one coming off of the rolls as they typically would. And that led to kind of this ballooning of resources. As folks know, the federal government pays states, and then states pay managed care organizations, typically on a per member per month basis. So each registered member is equivalent to revenue in those systems. And so as membership, increased, the availability of resources in Medicaid also increased. Additionally, during the public health emergency, we had a lot of capital infusions into the Medicaid program. So this includes the CARES Act funding that came in, the American Rescue Plan Act, ARPA funding that came into the system. And so there was just this flush of resources and capital that really carried us through, the essentially 3 years, 2020, 2021, and 2022, that the public health emergency was active. However, when the public health emergency was formally sunset, states had to then start renewing eligibility redeterminations and started revisiting and taking people off of the rolls, right? And that had a pretty significant impact in enrollment. And that's ultimately what this slide is demonstrating here, is that it's called renewals, eligibility redeterminations, or Medicaid unwinding, lots of different terms, but it all means the same thing. And we started to see this dramatic reduction in enrollment. So again, as the finances are tied to revenue, or as to bodies, excuse me, if the number of enrollees goes down, so does the financing available to fund the program. Now, in Arizona, we had lots of other things going on. And so before I move on to the next slide with those details, if you haven't, please scan our QR code and check out that blog that provides a little bit more detail about the history, of Medicaid unwinding. And like I mentioned, in Arizona, there was a lot of other stuff going on. So more recently, everyone is aware of HR 1, or the Big Beautiful Bill that was passed earlier this year. And now the budget analysts are starting to produce analysis of the impact of that bill. So the Joint Legislative Budget Committee here in Arizona just recently released this evaluation that demonstrates that not only has enrollment reduced and therefore revenue reduced due to Medicaid unwinding, but now because of HR 1, we are expecting further reductions over the next couple of years due to its various clauses and features. So the point of this comment is that things were already pretty rough in Arizona specifically, and unfortunately, because of the impacts of HR 1, we will continue to see a reduction in resources as well as enrollment, because there are some requirements in the bill that impact enrollment. So we're going to continue to see reduction. So the market not only has contracted, but it is expected to continue to contract, which puts many system players at the state level, managed care organizations and providers in a very tight set of circumstances. Concurrent to the market contraction, there is also this disruption happening. And so as many folks know, lots of things going on in Arizona, but there was historic Medicaid fraud that took place during the public health emergency that over the last couple of years is being reconciled by the Attorney General's office and Access. But at last count, it's actually greater than $2.5 billion. It's now expected $2.8 billion. But hundreds of providers have been taken off of the rolls after they were investigated and determined to be bad actors. And then, dozens, if not hundreds of folks are reported still missing. And there were, a significant amount of deaths associated with that. Concurrent and at the grand scale, you can just see some of these headlines, right? There's just all kinds of stuff. We are seeing market consolidations, mergers and acquisitions. St. Luke's Hospital, closed temporarily in Arizona and is now under new ownership. There's some very large provider organizations that have started consolidating or closing various clinics or programs. So we're seeing this left and right. And then additionally, there's AI, right? A whole other world of things to consider and think about, and how the digitization or the AI revolution may impact our work. My hope is that it will result in opportunity more than anything. And so far, there's been a couple of big headlines that talk about, staff turnover or layoffs attributable to AI, but that hasn't hit the mass market yet. So we're still in this phase where there's opportunity for us to learn how to capitalize on AI to increase our capacity, to reduce administrative burden, reduce costs, and things of that nature. And so even beyond, we're not done yet. There's a couple of things on this screen, and forgive me, I meant to do this a little bit differently, but first and foremost, we also have Arizona procurements that are coming up. So the ACC REBA health plans, their procurement is scheduled for the 2027, I believe. So that is pre-scheduled and something that was coming up. The Access 1115 waiver is due in 2027. So we have to submit that now, or we're working on it now because it needs legislative approval. So that it can be submitted. But that's going to dramatically shape and change, what the service coverages are, what available benefits are, different program requirements and things like that. So that is a monumental lift to dramatically change, potentially dramatically change the Medicaid program in Arizona. And then very recently, kind of this last layover, our long-term care proposals, contracts, they had been bid about 2 years ago. They were awarded, and then there were protests. And so just last week, I believe it was. Oh, excuse me. I guess this was a little while ago. But just a couple of weeks ago, Medicaid determined that they were going to cancel that procurement, and they are going to rebid it. And so, starting next year, we are expecting an all-text procurement. And then even outside of that, I think there's like 4 different lawsuits happening in developmental disabilities right now for failures to provide benefits and services or changes in funding because of HR1. The parents or family members as paid caregivers funding has been eliminated. So there's a lawsuit about that. There's a whole bunch of things going on. And so this next slide is not going to have the punchy impact that I wanted it to because I am using this format. I didn't like turn on the slideshow with all my animation and transitions, but in essence, everything's fine, right? All these things, we're just going to have to make it through. And so recognizing the constraints and the impacts of all of these dynamics, where do we begin? Where do we start? What should we be focusing on? This is not intended to be a histrionic conversation or, to incite any type of fear, but really wanted to just lay out the lay of the land, right? Like lay it all out. This is kind of where we're at. And we are definitely in extremely challenging times. This is not the first time that we have experienced program cuts and disruption or market contractions or disruptions. Those things happening concurrently definitely makes a complicated process or a complicated environment for folks to navigate. And so I wanted to first start off by turning the ship around and focusing on what do we do about this. And I wanted to start off by focusing on us as individuals, as human beings, as leaders, as professionals that work in this field. I attended a conference a long time ago, and there was a whole presentation at the time. It was at the federal level. It was a SAMHSA Children's System of Care Conference, if I remember correctly. And they had a whole presentation around waiting for Superman, right? And how, who you're going to call. You can call the Ghostbusters if you want to. You can hail the bat signal, or, you can call and wait for Superman to come save us. And the unfortunate reality is that Superman's not coming. There is no Superman. We have to save ourselves. We have to solution and figure out paths and how we can build resilience in our own organizations and agencies and programs. And so what does that look like? Some of these slides are a little cheeky intentionally. I had a little bit of fun with them, so I hope that they land correctly and are not offensive by any means. But the first one is we have to take care of ourselves. I know that this might be silly. I say this all the time, actually. But, we really do have to take the time to take care of ourselves. It is easy to catastrophize and doom scroll and, feed into fear mongering. And again, I hope that that's not the way any of this information is being presented. That's not the intention. But there's a lot of things to be worried about. There's a lot to be stressed about. And when I'm talking with providers and managed care leaders and state government officials and even federal level folks, it's just at a conference last week that had several feds at it. And they were just as disheartened as the rest of us, right? Recognizing the impact of these changes and all of the things that are going on in this field. And so it's our job, right, as individuals, as professionals. I'm a social worker, so you're getting the social worker side of me today, to make sure that we are practicing good self-care, right, and doing what it takes for us to take a step back when we need to. And in that, one of the things that's important is it's very easy to get mired in the weeds, in the day-to-day, and this policy change, and that comma became a period, the may became a shall in this sentence, right, of policy and legislation, or understanding like what is the future going to hold. When we are mired in the weeds, right, when we're stuck looking at the crevices of the bark of the tree, because that is, how we, um, it's our strategy like that we got to dive deep, right, to figure this out and sort through it and get into the nuts and bolts of it. There's a time for that. It is very important to do that work. And as leaders, as executives, as CEOs, as managers, as supervisors, as directors, at whatever level you might work at, it's also important for us to take a step back and get on the mountaintop, right? Or get on the balcony. There's lots of different analogies. Get in the helicopter, however, whatever term you want to use, to take that step back and really look at the forest, right? We have to dive in. We got to go, to the morsels of fiber, of the bark of the tree, right, in order to find solutions. 100% get that. People always say death is in the details. I always say opportunity is in the details. So like I get the nuanced approach, and there's the opportunity or the need for us to take that step back. And see all of the players on the field, right? See all of the pieces that are moving. And I hope that's part of what today is helping us do. Once we do that, it's also important for us to grieve. I know this is not a normal conversation in a work environment, and this is, maybe more of a support group today. But grieving the loss that we are all experiencing collectively, systemically, as a community, as providers, as helpers, as people who entered this field, to give a helping hand up for others. I know many of us in this field have personal lived experience or family members, right? And when we are doing this work, boots on the ground, we're thinking about that cousin or that aunt or that high school friend or that parent or that loved one, right? And using that as our motivation. So it's easy for us to get very emotionally attached and very invested in our work, and that's critical, right? That's the beauty of peer support work and the beauty of, behavioral health is human connection. And in that, when we're going through turbulent times like we are now, taking the time to acknowledge that we are all in a community and collective like grief process of letting go of the services that used to exist, letting go of the confidence or safety that we had in last year's funding, right? Acknowledge it, call it out, work through it. Grief is a process. And the reason why this is like grief and imagination is it is very difficult to be creative while you're grieving. Just from like a brain chemistry perspective, is very difficult to be in that state, and then somehow turn on your brain and be optimistic, right, at the same time. And so you really have to do step one so you can get to step two, and that's the intention of the message here, is work that process. Do whatever it is you need to do, right, to process those feelings, and then allow yourself the space to start dreaming again, to start getting creative and start disrupting kind of the way that it's always been, disrupting the mental models we've formed, disrupting the revenue model that we have, right? Our program mix, our service array, our staffing model, like these are all things that are likely going to evolve and look a little differently next year than they do right now. So, encourage you guys, definitely take the time to go through that process, and honor it, respect it. It's a real legitimate experience. And it's also an opportunity to plug in. And we're going to talk, when we get into like organizational strategies and system level strategies, we're going to talk about like partnerships and community partnerships and stuff. But like, we really are in this together. The thing I love about this field is, going back to previous comments, is most of us are here because we have some type of human connection or touch point to this work, and to the populations that we serve. And so most of us are compassionate, empathetic, genuine, authentic, motivated, individuals. Lean in, right? these are our people. These are who we have, right? And there's a lot of different opportunities and resources that are out there. Some of the folks that are on, this slide, like Arizona Council of Human Services Providers, just does fantastic work. The Arizona Alliance for Community Health Centers, like if you're an FQHC, like that is a group. Dive in, have conversations, take people to lunch, build connection, build relationship, network, because that is how you will learn new models or find new resources or just share and collaborate with one another. I know, again, these leadership strategies I'm talking about, I know none of this is like monumental and life-changing, right? This little section is intended just to be a gentle reminder of things that we already know, but especially in times of stress, we might forget about, right? So recognizing, we're taking care of ourselves that through this segment of recommendations, what is it that we should be doing as a system? And as system leaders, we've had the opportunity to present this for members of Access and other health system leaders across the state of Arizona. And so what are the things that they should be doing, and what are the things that we as others in the system should be looking to them to accomplish? And we're going to spend some time on all of these. But the first one, or the first recommendation that we've shared, is really getting grounded in our mission, vision, and values. So again, it's kind of that like coming back to home, right? Like back to the basics. Let's ground ourselves in who we are, why we're here. Medicaid as a program has a very clearly defined scope of practice. It is written in the state, federal statute. It's written in a state statute. They are authorized to do A, B, and C. And I know that that is often inadequate and insufficient to meet community needs, and doesn't always even align with evidence-based practice. But there is a role, right, for that organization, Medicaid authorities and agencies to focus on their mission and to focus on the things that they are here to do. Looking at process optimization, as to thread this needle, when the system ballooned and grew, we had resources to do all kinds of stuff, right? We were introducing new services and new programs and being creative, and we were funding, our differential adjusted payment program and targeted reinvestment program, and we were, launching and innovating new stuff. And that was great, right? Many of those programs and services were tied to time-limited funding, ARPA grant, CARES Act money, things like that. And so that stuff is likely going to reduce or potentially even be eliminated out of the program. And so looking at how we can optimize the system, not just from a service array or having to cut services, but like administrative burden. Lord today. Shall I bring up box 19, right? Which is on the CMS 1500 form, the volume of administrative burden that providers are currently experiencing. There's a huge opportunity for system leaders to reconsider administrative requirements and deliverables and all of the checks and balances. We need checks and balances clearly because we've experienced what happens when those are not in place. And some of those served a purpose for a time. And maybe we had built other systems or other processes, and some of these checks and balances that were initially very important can possibly be sunset now. So going through the process to look at that. When we talk about focusing on evidence-based practice, again, I don't know about y'all, I talk with a lot of providers. I talk with a lot of innovative people, creative people that are pushing the mark and wanting to do things differently. And we need that type of ingenuity and creativity in our system. And there's not always a lot of evidence behind the work or behind the proposal, right? And so leaning into the things that we know work, and again, recognizing we no longer have excess capital and resources to be experimental and creative, like trimming back and focusing on the things that we know are effective and that we know fill gaps. And within the scope and role of each individual agency that makes up Health and Human Services in Arizona. I am a firm believer, firm believer in stabilizing cash flow for people. At the core, that is the struggle that I hear a lot when working with providers and everything, especially in a fee-for-service environment. Not to mention, delays in payment and all of the documentation requirements and administrative burden associated with it, but just simply because of a fee-for-service environment, it is difficult for providers to predict revenue because human behavior is complicated. And as the fluctuations in enrollment are happening, you've got lots of new folks that may not be accustomed to the Medicaid program or how to navigate services, and then other folks that were enrolled are no longer enrolled, and so there's this constant acquisition cost. This is a business term. It sounds very weird in a Medicaid environment. So forgive me. I think I just said customer acquisition for the first time in a Medicaid context. I don't know if that fits or lands very well, but there is truly a cost, of getting new members, right? Your business development, your marketing costs, your intake specialists, all of the eligibility and enrollment verification processes, like that is our customer acquisition cost. And when we go through all of that work to find out that folks aren't eligible or, that there are other barriers, it definitely creates a loss of revenue, right? And a loss of, it's more work without payment, right? Shifting the payment model along, looking at pay for quality, again, with risk sharing, is definitely an opportunity for us to explore again. So it's really the alignment. I call it the golden thread of value, right? So it's aligning the what with the why, and with the payment model. And of course, this is a little bit tied back to process optimization, but in the context of the AI revolution that we are all experiencing, there is absolutely a place for artificial intelligence to reduce the administrative burden and therefore costs associated with operating our businesses. And I think that there's a lot of stuff. I know Access is piloting and doing lots of work here. To be extremely clear, I am not personally a fan. I don't think that AI is ready for clinical decision making. So, I know Medicare is piloting AI for prior auth decision making. I don't think we're there yet personally, but I think in operations for filling out forms and flagging gaps in care and little things that are more data oriented, non-clinical, I think there's a lot of stuff that we can do to help reduce costs and administrative burden in the system. So what does this actually look like? And so one of what is presented on the screen is a visual depiction of what an agile product development process looks like. In agile product development, so think about how software is developed, like how Apple comes up with the latest software iOS system, right? Typically what they do is, they have their scope of work. Here's the box, the parameters in which we're operating in, right? But that list is driven by customer requirements. So what are the solutions that we are solving for our customers? What are the problems that we are solving? What are the jobs that they are hiring us to do for them? So obviously, to make this extremely simple, if you are an immunization clinic, right? The job your patients are hiring you to do is give them an immunization, right? If you are an SMI health home, the job the customer is hiring you to do is assess their needs, prescribe medication, manage their care, coordinate their care, right? And so in agile product development, the thing that makes it unique, though, is that it's an iterative process. And that at each point of those iterations, you're going back and getting customer feedback. And so this is really about member and family driven care, elevating voice and choice, making sure that the members and their caregivers that we are serving are driving this process and telling us what their needs are. And they are the ones designing the system versus us designing the system based on what we think their needs are. And so in Agile, you can kind of see through this process, you go through iteration number one, you get that feedback from the customer, and then you say, okay, for our next, sprint cycle, or for our next, month of development or quarter of development, or goals for the next, 60 days, 90 days, 180 days. We've heard all these things from our customers. We're going to incorporate them into our next development cycle, and then we're going to check back in and see how it goes. And so typically these cycles are about 30 days long or even 2 weeks long if you're moving real fast. In our world, I think that's probably a little aggressive. It works in technology and software development, but I don't know that it would work in the system as large as the Medicaid system. But whether or not we do this every quarter, every 6 months, or even every year, making sure that there is a structured process that we are continually going back to the customers and understanding what their needs are, and then using that information to inform the next development process that we follow. Now, the big question, and again, because I elected not to turn on the PowerPoint today, but to just kind of flip through the slides, there was some animation on here that would go through the series of questions. But the big thing that stands out is the question of who is the customer. And that depends, right? Traditionally, in real proper business sense, the customer is the person that pays you. And in our world, you could say, well, if I'm a provider, the MCOs pay me, right? And if I'm an MCO, well, it's the Medicaid authority that pays me. But if I'm the Medicaid authority, it's the federal government and the state legislature that pays me, right? And if I'm the state legislature, it is the constituents that elected me and raised money for me and volunteered for me that pays me, right? And so at the end of the day, I hope that our answer for who the customer is really is members and families, the folks that we are here to serve. Although we do have this market distortion in our field where we can't solely react and respond to the needs of members and families. We also have to react and respond to the needs of providers. If you're an MCO, providers are part of your customer base, right? If you're a provider, an MCO is part of your customer base. We all need to react and respond to the needs of the Medicaid authority, and we all need to react and respond to the needs of the legislature, because that's the way publicly funded work works. But the intention of this slide is ultimately just to reinforce part of how we get through turbulent times is keeping our ear to the ground and staying as close as we possibly can to the customers we serve, because by listening to their needs and receiving their feedback, documenting it, capturing it, that is where we will find innovation. They will tell us what they need. They will tell us how to guide this ship. And that is overly simplistic, but also magical. I mean, there's a lot of great solutions that come out of that approach. This slide, these are just two different strategies, or I wanted to provide very tactical things today, as opposed to, just kind of high level, almost esoteric things. But there's two different approaches that can be utilized to help consider options and help define how do I get from here to here, right? The first one is understanding a force field analysis. So looking at where we are today, what is the proposed change that we're making? And then the force field analysis identifies what are the competing forces? What are the driving forces? What are the constraining forces for this decision? I often like to incorporate kind of the PESTLE framework, which stands for political, economic, social, technological, environmental, and legal. So using those as the forces, but unpacking them a little bit further. The political environment, is this a driving force or a constraining force, right? And depending on what we're talking about, the answer might look a little different. So using that, you can then assign numeric values and scores, and it allows us to identify kind of a quantitative or an objective approach to understanding the environment, as well as help inform what would work, what's feasible, right? On the right-hand side of the screen, is a thing that I had created, and then I found out that someone else created it. So I merged our names together. So for some, you'll know this as a Bardock analysis, but I like to call it a Hess-Bardock analysis. Excuse me. And what this does, this is really a decision-making tool that I use all the time. I use it all the time. I was just using it an hour ago, actually. And so what you do is you identify first, whenever you're in a key decision, how are we going to navigate this? What are our options? You first identify your criteria. What are the things that matter to us? These may be your values. This may be, your mission statement, your vision statement. These might be customer requirements. They might be operational requirements, but you define your decision-making criteria. Then you assign a weight to each of those things. Obviously, some things are more important than others, right? So you assign a numerical weight, like a 1 through 1, 2, 3, 4, 5, or however you want to do it. And then you identify all of your options, right? So, you go out and you look at what are the different strategies, or you brainstorm and you come up with all your different options. And then you literally just calculate, right? So, opportunity number one, to what extent does it match criteria number one? So, we use a numerical value. Again, so let's say, on a scale of 1 to 5, criteria number one is absolutely a 5. It's a perfect, like it fully meets this criteria. We gave this criteria a weight of 2 because it's the second most important thing. Therefore, the answer in this box is a 10, right? So you kind of make your way through here, and then you add up the total. So by the end of this, selection, you would end up with a score of 100 or, 80. I'm just doing this very, very simply, as you can tell, but you work it out, and then you can say, okay, based off of our criteria and weighting, option number one is clearly the highest scoring or the highest ranking. So it breeds some objectivity in your decision making, especially in tough decisions that can be emotional. There's emotions in every decision, right? But some of these decisions around contraction, consolidation, shifting of priorities or direction, those are tough calls, right? And so this tool helps a lot of folks be able to navigate those decisions a little bit more objectively. Of course, this doesn't have to make the decision for you, but you can at least say, okay, I at least have some clarity and insight into how to approach this decision. And then beyond system strategies, I think all of those things, organizations can apply. So let's just kind of roll them all down, right? And we will see a little bit of duplication on some of these as well. But looking inside our organizations, helping human services providers or managed care organizations or technology companies, what are some of the things that we can be doing? Similarly, you're going to see that same thing, like getting grounded in why we're here. Every organization has a unique and distinct mission, vision, and values. We all have, subtle notes or priorities within the population we serve, or the scopes of services that we offer, or the level of care that we offer. Our motivations for doing this work might be a little bit different. So getting grounded in that is always step one. So we have clarity on what our intentions are, right? Making sure we understand what that is. And then the next thing that we can do is get ahead of this. Disruption is happening. Contraction is happening. Let's do it by choice, right? Let's voluntarily self-disrupt. What does that mean? That means embracing change. And of course, it means challenging our assumptions, that creativity and experimentation, looking at market gaps. So, obviously you need some data to inform that, but understanding, where those opportunities might exist. If we're going to use, low-end market disruption or blue oceans or blue sky or red, I don't recommend red oceans. And if none of those words made any sense to you, shoot me an email and I'll gladly explain them all. But looking at untapped market potential. Of course, looking at emerging technologies, and then, reinforcing that message on listening to your customers. Again, not intended to be insensitive to the moment we're in, but Winston Churchill did famously say, never let a crisis go to waste. And what is embedded in that discussion or statement is the opportunity to capitalize on this moment. And again, it is not lost on me at all the true human impact that funding cuts and this disruption is having. I have lost people. I have a personal connection to this work. I have lost family members. I am a legal guardian. My ward, who I'm in charge of or oversee their care, is not doing well, and I have to navigate that. I mean, this is very much so hits home. So please know I'm not, losing the humanity in any of this. While trying to offer some business strategies, to our organizations that we need. It's critical, right? This is an attempt at saving the ship, to make sure that we all come out of this stronger, and more agile. And so using this as an opportunity to go back to your business, look at your model, figure out where there are opportunities that have been presented and you passed by on them previously, right? Like getting in there and really doing the work of self-disrupting your company. I went through this process during COVID a couple of years ago, rewrote my business plan, rewrote my pro forma, changed the way that I manage services, the way that I staff my stuff, like all of it, right? And it was a heavy lift. It was a lot of work, but it definitely was worth it. So use that opportunity and the time. And then this other quote of choosing your own adventure. There are a lot of people, and I mean this respectfully, because I totally understand the moment we're in, or at least I think that I do. I have my own experience in this moment, right? I understand the fear, I understand stress, I understand the concern about the folks that we care for in this work, right? Members and families. All of that is top of mind for me every day. And in that, there is like we are self-determined, right? Like we get to navigate this how we want to. And I am strongly encouraged and hoping, that some of the messaging out of today, is, take charge, take that opportunity. Don't let this happen to you, right? Like own the moment, figure it out, get ahead of it. We are resilient. Like resiliency is embedded in who we are, right? Survival of the fittest. Like, let's get out there, figure out, where all the pieces are on the board, and then navigate them. And that's going to be an individual decision. That's an individual journey, right? For each organization and for every leader and CEO. And whatever that result is, it's okay. But don't. My hope is that we will not fall victim to the moment. It's probably really insensitive to say that, but that we again will allow this opportunity to fuel us, not take us out, if that makes sense. I hope that came across from an affirming and supportive way, because that is absolutely the intention of where I was headed. So to unpack this a little bit further, what else can organizations be doing? And diversifying revenue is critical. It is absolutely essential. I work with a lot of organizations. I see a lot of budgets. I see, a lot of revenue streams, kind of proportionality and how folks are getting paid today. And there are a lot of organizations out there that, have very limited sources of revenue, very, very limited revenue streams. So definitely an opportunity to expand that. We're going to double click on contract revenue in the next slide. So I'm going to focus on some of these other things. Grant writing, whether that be corporate and foundation grants or government grants, some folks have not actualized the value of that. But I have, one provider organization that even just by June of 2025 had secured about $6 or $7 million in new funding just through grants. It was literally 100% of their annual budget. They doubled their annual budget just with grant funding this year, which is remarkable. And so don't let that opportunity go by the wayside. There's a lot of great resources and ways to create different revenue from those resources or strategies, excuse me. Even just looking at traditional development, many of us are nonprofit organizations. If not, launching a nonprofit organization is not as difficult as it used to be. And so getting that 501c3 status so that you can engage donors. Every one of us is out there helping people, right? And those people have families, and those people themselves recover, right? I've lived experience. So many of us in this field have lived experience. And so create an opportunity for people to support you, whether that be through individual monthly giving or large gifts, or donor legacy giving, excuse me. You can see on here, we have, special events, galas and fundraisers and all of that stuff. I mean, again, I have another client that we've worked with, and they raise pretty much their entire $5 million a year budget. And I know these are smaller organizations I'm referencing right now, but they raised their, $5 million a year budget purely through these things, right? Individual donors, large gifts, legacy giving, and events. Even, Banner, the Health Foundation, a couple of years ago, I spoke at their annual gala, and Banner, the largest employer in the state of Arizona, they do this work, right? And they were able to secure over $1 million that night in unrestricted funding to help gap fill things that Medicaid wasn't paying for. So, I mean, it may not be intuitive and it may not be stuff, that we really see as a true opportunity, but I would certainly encourage you to consider it. Looking at strategic partnerships, we're going to talk about that a little bit more later on. But finding, those organizations to collaborate with, even if they're quote unquote co-opetition partners, folks with similar, scopes, but complementary, right? So, depending on what your scope of practice is and who your population is, partnering with entities, co-location agreements, all of that stuff. Cut down at a minimum, we can reduce lease agreements and expenses, by co-location and exploring other ways to do that. Social enterprise administration is a really cool, awesome, creative thing that I've seen some health and human services organizations do very, very well. And that is as simple like starting a business. I actually don't know a lot about this particular organization's work, so I'm going to talk about it because it is public information, and it's limited public information, but Copa Health in Maricopa County or in Arizona, they're an SMI clinic, and they are just doing really cool, innovative stuff. They have a whole warehouse worker technician training program, and they're taking folks that are in recovery, both from substance use disorders and mental health conditions, giving them job skills training, and then getting them into employment, right? I know another client of mine that operates a number of, has a number of commercial kitchens because of the programming that they offer. And they have, decided to use that or use those assets, those commercial kitchens during their downtime when they're not serving breakfast, lunch, or dinner. And they're starting a pet food treat company, which again is just, you take it to market, you get in PetSmart, and you're creating new revenue that is unrestricted and untied to claims and codes and, all of that work. And then, of course, if you happen to have reserves or the ability to invest your resources, of course, do that and invest them well. Again, we're gonna double click on contracting revenue right now. So one thing that I often see with folks is that they frequently will have a payer mix, right? And this slide is not intended to be illustrative of all providers. Every organization works a little bit differently. But the intention, and let me see if I can actually, there it is. All right. Again, I apologize. I intended to do this a little more interactive than I ended up doing it. But it's essentially a case study, right? Or use case. So what I often encounter, especially in smaller organizations, very mission focused, that, grassroots or organizations that are more closely startups, they come in, they get a Medicaid contract, they get in with one payer, and they are like, all right, I've got my resource, right? Eventually they might broaden that lens and, okay, now we're a network with 5 payers or all of the ACC health plans and things like that. But really leaving opportunity on the table in employer sponsored commercial insurance, marketplace insurance, VA, TRICARE, et cetera. So you can see, on option on the left, that Medicaid makes up 65% of the revenue, and assuming that there's some, other resources that are there. This is why the intention here is not to talk about health plan contracting, but if you need health plan contracting, or if you're not contracted with health plans, go do that. Definitely. And, of course, we're happy to help, but get those contracts because they're important. The purpose of this conversation is around the percentage allocation of revenue. And so while in 2024, organizations may have been 65% Medicaid and then 35% other things, there's a strategic opportunity to pause, look at those revenue streams, and consider how we may want to adjust them or may need to adjust them in the future. The implication of this pie graph is the revenue is flat, right? So let's just say, this is a $100 million a year organization and this is their composition. they can still be $100 million a year organization simply by changing the composition of revenue. And so this particular slide is not intended to imply a reduction in revenue, but looking at how we can preserve revenue simply by changing the payer mix. Now, different health plans, different coverage types, they have different covered benefits. So like peer support services, not often included in commercial insurance, right? There are some commercial provider or health plans that do cover peer support services. So make sure you check those explanation of benefits and covered benefits. But looking at your revenue composition and your payer mix now is an ideal time to start doing that, and then strategically thinking about how we can make shifts in that. And of course, that will be tied to marketing strategies and communication strategies and community outreach and engagement strategies. But definitely take the time to do that. And if you are not contracted with all of these folks, take the time to do that. I believe that there are 30, 40-ish different health plans that operate in the state of Arizona across various lines of business, employee assistance plans. I mean, there's all kinds of things. Even with the self-pay and out-of-pocket model, there are ways to make those numbers work through, subscriptions and memberships and digital health solutions and things like that. So, again, take the opportunity to think about not just, what we're doing, but who's paying for it and how we can even evolve there. And then another example of a tool that I brainstormed and thought about and labored over and created on my own, only to find out someone else had already done it. And so this is an Ansoff matrix. I did not modify it, so I don't get to change the name. But this is just a framework for thinking about business development. And so you can see, looking at two things, starting from the bottom left here, this is where you'll have the lowest amount of risk because we're talking about existing products in existing markets, right? And so finding ways to have market growth, again, simply by changing your payer mix, that is an opportunity to have market growth, right? Or by identifying additional populations that also need your services, or finding other ways to engage with people differently. One obvious way is, if you have a kind of a captured, engaged patient pool or audience, figuring out what other needs can you meet. So I often, especially if you're in the substance use space, think about what are the things that individuals that use substances or that are in treatment for substance use disorders, what are their other needs, right? Housing always comes up, health-related social needs always comes up. So we also need primary care, right? Individuals need maternal child health and family planning services. There's a lot of sexual health, STDs, STIs, HIV work in that space. So are there complementary services that we can add on in this space to kind of help us work? And some of that, is looking at new products in existing markets, right? So, can we just grow what we offer today? Well, that depends. That's largely going to be, at least right now in the moment, probably based on, payer diversification. Can we add new services though, and better meet the needs of the people we're already serving? Absolutely. Definitely consider that. Can we take what we're doing today and move it into an existing market, or I'm sorry, into a new market, forgive me. There is absolutely opportunity for that. Now, unfortunately, every Medicaid program in the country is impacted by HR 1 and experiencing the cuts that we are here in Arizona. However, not every other state is still concurrently navigating through the Medicaid fraud, policy changes, and some of the other nuances that are very unique to Arizona. And even, looking at the state, access breaks the state into 3 different markets. So if you're, only operating in Northern Arizona by, for whatever purpose, there's a whole central region that has, a large urban area, lots of patients, lots of members, and there may be some creative opportunities or strategies for you to consider there, or vice versa. If you're operating in, an urban area, rural health is going to be a challenge. There are absolutely ways to do that well and to still pay your bills and be able to pay your staff and keep your doors open. But considering those things, and then the highest risk activity, and it's just because it's like new, right? So you're doing new products and services in new markets. I definitely would encourage folks to avoid that unless there is like a real strong business case and business plan and market intelligence and all of that really driving it. We are seeing a lot of very cool like AI platform tools being developed and different ways that people are delivering care. And so there's absolutely space for this level of creativity, even in a market contraction. But I would focus those things really on what are known as low-end market disruptions. So where you are finding a completely untapped market and introducing something new and innovative that will migrate people over. So again, when Netflix was introduced and put Blockbuster out of business. I know we are just about coming up on our time. I have one more slide, and then I'll hopefully save just a couple of minutes for questions if we're able to get to them. But I wanted to provide some additional kind of more tactical strategies for organizations. And so some of this stuff, not the most unique necessarily, but as a gentle reminder, as we are navigating all of this, where can we, look to hang our hat a little bit? Increasing brand awareness and values-based marketing, always an opportunity to get the word out there, right? Increase the favorable visibility of your company within the constraints of Medicaid marketing requirements. Looking at customer retention and loyalty. So again, this kind of goes back to that, add-on products or services. We've already got a captive audience. We have a membership pool or client base. What else do they need? How else can we help them so that you can, keep growing even in those areas? This has been a consistent theme, but operational efficiency, where can I automate a process, reduce a paperwork, requirement, digitize something, looking at, workflow analysis. There's also in this operational efficiency, this isn't something we do a lot in health and human services, but vertical integration versus vertical segregation is typically when you bring something in-house versus when you push it out to a vendor. Oftentimes, especially if you don't need like if you don't need a whole FTE or you don't need a printer all the time, or, as opposed to leasing it, maybe consider, actually, okay, we're going to revert back to using UPS, yeah, the printing company, right? Because we don't actually print that often, so we don't need this giant, lease agreement or whatever that looks like for you. Whether it's vehicles or, buildings, another great opportunity. Looking at strategic partners. So we talked about that briefly, but think about forming joint ventures. Think about, looking at what could it look like for co-location or looking at, different you can shift cost drivers through vendor relationships, right? So if your insurance is extremely high due to a particular service that you offer, is that something that you can, negate and push to a third party so that they bear the burden of that insurance expense or whatever the overhead might be, right? And allow them to specialize while you kind of generalize. Looking at that innovation and agility, so staying lean, staying agile, piloting stuff quickly monitoring stuff and making quick decisions. Now, it is definitely tough, especially, if your brain, your prefrontal cortex is flooded with cortisol and we're stressed out and, it's difficult to make decisions. And it is definitely going to take some, practice and coaching and confidence and all those things. But like now is definitely a time to stand stuff up quickly and shut stuff down quickly if it doesn't work, right? Don't allow things to linger because that, is cutting costs. It's exhausting resources, time, finances, energy, all of that. And then I know many of us do not hope for this future, but looking at consolidation. Looking at mergers and acquisitions, either to acquire other companies, that is the best way to grow fast, right? And there will be companies that need to be acquired. There will be programs, there will be membership populations that need to be acquired in this time. So looking at those even as opportunities, for your own growth, if your organization is positioned well, or, if for whatever reason you need to be considered to be acquired definitely be proactive about it. There's absolutely no shame or harm in that. Again, at the end of the day, what I love about this field is we're here to help people, right? And if we get acquired, then our program gets to last. We get to continue serving people. It might just look a little differently than we originally thought. So that is the end of today. I, of course, wanted to say thank you so much for taking the time to join us. We do have 1 whole minute left for questions. So if there are any questions you guys want to pop in the chat box, I am more than happy to hang out. If you want to come off mute, I would love to hear thoughts, feedback from folks on today's presentation. I just want to open the floor for you guys. Thank you so much. Yeah, we appreciate it. Really, really grateful for all of you. Well, please feel free to reach out if you have any questions. Happy to share this presentation if folks are interested in it. But otherwise, hope you guys have a fantastic rest of your day. Check out that blog post, stay connected, sign up for our newsletter, all of the things. We would love to continue the relationship and conversation as we move forward. All right, awesome. Definitely we'll share that with you guys. All right, we will be adjourned. Thank you guys so much.